Nutritional interventions are recommended for all people who could benefit now or in the future from nutritional care. That's right. Nutrition interventions are recommended for all people who could benefit. Nutrition intervention is a broad term that involves many tactics and strategies, including optimization of hydration, oral nutritional supplements, diet, and even tube feeding and parenteral nutrition. Intervention can also be accompanied by psychosocial care and probably should in many cases. And healthcare providers, physicians, surgeons, nurses, therapists should develop and implement an individualized nutritional care plan for individuals with or at risk of diabetic foot ulcers who are malnourished or at risk for malnutrition. Specific nutrition plans should be individualized and based on factors unique to each patient, such as existing diagnoses, patient preferences, age, lab values, pre-existing health and medical conditions, tolerance of vitamin mineral supplements, access to professional caregiver family support with grocery shopping and cooking, where they live, access to all of this, and resources and more. And the point is, this is unique to each patient. There is no one size fits all when it comes to nutrition care plans. And as part of the plan, it's important to set goals that are realistic and that promote improvement. This is the big idea. It's also important to set these realistic goals that are attainable to keep engagement high, patterns of success for the clinician and her or his patient. And the ultimate goal here is to help the patient consume food, nutrients, and fluids in amounts that meet estimated nutritional requirements that maintain, reduce, or increase body weight depending on BMI and depending on the goal, and that prevent unintentional weight loss. And if we're talking about basic adjustments, if we're talking about hydration and calories, hydration and caloric intake are the two most common starting points when undertaking a nutritional intervention. Hydration and caloric intake are discussed in greater detail in video segment 2, as you hopefully have already seen, but as a recap, standard maintenance fluid requirements are between 25 and 35 milliliters per kilogram body weight per day for healthy adults. And you can offer most individuals with nutritional risks and DFU, diabetic foot ulcer risks, a minimum of 30 to 35 calories per kilogram body weight per day. And 1.25 to 1.5 grams of protein per kilogram body weight per day. And for folks with a high BMI, lower calorie intake while still meeting protein goals may be appropriate. This is important to tailor that based on BMI. If we're talking dietary changes, they can be difficult to sustain, even in the easiest sort of period. But they can have a significantly positive impact when it comes to nutrition intervention in patients with diabetic foot ulcers. And for starters, patients should start by eating less unhealthy fats, just trans fats, saturated fat, and cholesterol, and eating more unsaturated fats. And caloric priority should be given to nutrient-dense foods. And sodium intake should be limited to help with control of blood pressure. And as much as that is an issue with these patients, nutrient-dense, high-protein fortified foods and supplements should be offered in addition to dietary changes when dietary changes alone are not sufficient to meet nutritional requirements. And in addition to dietary changes, oral nutrition supplements, or ONS, which we'll cover in more detail in this segment, can be taken as part of or in between meals as needed to help provide additional protein and nutrients as needed. A quick tip here is to talk to each patient. Talk to your patient about varying the type of nutrient-rich foods and supplements to avoid taste fatigue. Just having the same thing over and over again for all of us can get a little bit dull. And just because we prescribe it doesn't mean that person's going to adhere to it. So mix it up a little bit. Or nutrition supplements are liquids, semi-solids, or powders that provide macro and micronutrients to help people meet their nutritional needs. Many times, proper diet alone is just not going to be sufficient for optimal wound healing. This is especially true in our patients with diabetes who have tissue loss, not even significant, massive tissue loss, but even just ordinary garden variety diabetic foot ulcers. These folks are often in a deficit situation, and a proper diet alone is not going to be sufficient for optimal wound healing. Again, I'm just telling you, I'm going to repeat this. Proper diet alone often does not sufficiently meet nutrient requirements. And for most patients with diabetic foot ulcers, or nutritional supplementation will be more effective than dietary changes alone. You need something extra. They have lost tissue for a reason. And starting oral nutrition supplementation early is important. There's no reason to wait in most cases, in our opinion. And doing this early is especially important for folks who are at greater risk for malnutrition and for those who are already showing signs of malnutrition. And we're going to show you here in figure 1 a really helpful kind of stepwise approach for looking after these patients with for ONS usage. If we're trying to choose the right oral nutrition supplementation, there are many options available to help achieve various goals. Some standard or general options focus mainly on meeting specific goals for protein, for calories or other micronutrients. Other types of specialized ONSs have specific ingredients to support wound healing, but they may not have added calories or proteins needed. In addition to specialized ONS, standard options may vary significantly based on their approach. And you can see some of these options in Table 9. Choosing the right one, whether that be a general or a specialized ONS or both, should be really a shared decision between the patient and the provider and really the entire team. It should take into account specific patient preferences. And it's important to understand that in many cases, it isn't an either or. In certain cases, usage of multiple ONS options can be beneficial. Let's just understand that. And just like there are different food types, we may need to employ multiple ONS options and approaches. While ONS can be more effective than diet alone and diet changes alone, all oral ONS usage should be administered along with a proper hydration and a balanced diet. They just go hand in hand. It makes sense. If we're talking about special populations, if we're talking about parenteral and enteral nutrition, some folks may be unable to meet estimated nutrition, energy, protein, and hydration needs despite nutrition interventions consisting of dietary changes in ONS usage. In these folks, you should consider discussing the benefits and harms of parenteral or enteral feeding to provide additional or alternative supplementary nutrition support. And in overweight and obese patients, which by definition is malnutrition. And as discussed in section 2, a common mistake is assuming a person can't be malnourished and overweight or obese at the same time. Many of these folks are actually sarcopenic with decreased lean body mass despite excess body weight. This is critical to understand. It's not only possible, but often encouraged for someone who's overweight or obese to meet the metabolic needs of the healing wound while simultaneously losing weight. These are not mutually exclusive goals or approaches. Weight loss should improve diabetes control, which helps heal the wound while also decreasing the pressure on the diabetic foot ulcer and spreading force out over a larger unit area with less force. And in older adults as a special population, a significant number of people with diabetes are geriatric, and this patient population may have a variety of social and physiologic needs that lead to decreased protein and micronutrient intake. For this patient population, and for this reason, geriatric patients should usually be suspected to be malnourished until proven otherwise. If we're talking about patient adherence, educating folks with diabetic foot ulcers about their dietary needs is, as well as the best sources of essential nutrients involved in wound healing, is a critical step in any care plan when you're looking after these patients. In a meaningful exchange of information, HbA1c, quality of life, and adherence to the intervention plan is improved. And people just do better. It's common sense here. And patients should be counseled on nutrition. This counseling can be done on one-on-one or in a group setting or both. And sometimes people get something out of a group setting that they wouldn't get out of a one-on-one, and vice versa. And if we talk about patient reminders, the following is a list of reminders that providers and patients can discuss each visit. We have to eat 3 meals a day and 1-2 snacks in between these meals based on blood sugar levels and goals. That's what we're going to try to advise our patients. No skipping meals. Try to consistently eat the same amount of carbs at each meal. If you skip a meal, don't try to make up for the carbs not eaten. Instead, stay around the same recommendation for every meal. If you have type 2 diabetes, you should consume about 20 to 35 grams of fiber from raw vegetables and unprocessed grain every day. FDA advocate consumption of 28 grams of dietary fiber per 2,000 calories consumed. Your diet should focus on whole grain foods, plenty of fiber, and choosing foods that are less processed to avoid rapid spikes and drops, peaks and troughs of blood sugar levels. So here are 3 frequently asked questions. We'll address these now and provide some insight. So sometimes the patient will say, you talk a lot about nutrition, but how important is exercise? The bottom line is proper diet and exercise go hand in hand. So both are very, very important. The next question a lot of patients ask is, do nutritional supplements taste badly? This is a common myth. Almost all oral nutritional supplements come in different flavors and formats. Most of the patients that I know actually like the taste of these things now. And if one type or flavor tastes bad to the patient, tastes bad to you, just move on to another. There are usually a handful of alternatives. And the third question is a lot of people ask is, does eating nutritious food and or oral nutrition supplementations cost a lot? It'll cost a lot more in the long run by not taking the right steps to keep your nutrition in check from the start. There are many healthy and nutritious foods as well as supplements that are affordable. And for additional resource information on diabetes, healthy eating, meal plans, recipes, and more, you can visit any of the websites shown on the screen below. Ladies and gentlemen, I want to thank you for viewing this segment. It's been a lot of fun putting it together with the entire Guidelines Central team and my friend and partner at USC, Maritza Molina. We hope you enjoyed this series. You can go back and revisit segments 1, 2 at any time. You can even do it in reverse if the mood strikes you. And you can visit the full guidance document at guidelinescentral.com/DFU. Visit other resources on the ALPS website. And just from the bottom of my heart, thanks.